Agrace provides both hospice care and palliative care. First, let's talk about palliative care. It's really an umbrella term used to describe specialized physical and emotional care that focuses on the patient's comfort and quality of life. If that sounds familiar, it's because hospice is one type of palliative care. Some forms of palliative care can be provided at any point in a patient's illness, and we'll talk about that in a minute. Now let's talk about hospice. Hospice is comfort care for patients who are in the last 6 months of life and are no longer seeking a cure for their illness or condition. When a patient or family chooses hospice care, they make the decision to focus on their personal goals so the time they have left is meaningful. To create a plan of care, the Agrace interdisciplinary team asks questions about the needs and goals of both the patient and their family. A hospice plan of care considers the whole person, body, mind, and spirit, so it addresses emotional and spiritual needs, as well as pain and symptom management.
Any pain today, or?
This patient-centered approach allows each patient to have a voice in how they want to live out their life.
All you have to do is let me know.
Hospice services also include support offered to the patient's family and friends. Agrace's Grief Services team provides support for 13 months following a patient's death. Our support can include pre-death visits by the counselor, phone conversations, and face-to-face discussions. It can also include participating in one of our specialized grief groups. These groups are geared to specific types of losses, such as the death of a spouse, a sibling, or a parent. In fact, we have grief groups for children as young as 5 years old. Agrace has been the community's nonprofit hospice since the early days of the hospice movement in America. But today, we're so much more than just a hospice. By expanding to offer other palliative care services, Agrace can now work with patients and families much earlier than just at the end of life.